The following segment is sponsored by Modern SLC Injections and Aesthetics. You may have heard the term Ozempic a lot in the news over the past several months. Dr. Hilary Taggart and Brittany are here to share more about this weight loss drug and other ones like it. Both of you, welcome to the show.
Hi, thank you very much for having us.
All right, everyone's talking about it. What is Ozempic?
It's a great question.
So Ozempic is, well, we are offering semaglutide, which is the generic medication for Ozempic.
Okay.
We also will offer tirzepatide, which is the generic for Mounjaro. Okay. So Mounjaro and Ozempic are FDA-approved medications. They can be very expensive if you don't qualify through insurance. So we are offering the compounded generic version of those medications to make it more affordable and accessible to patients who could benefit from the medication but don't qualify through insurance.
Okay, so now we know what they are. How do they work?
That's a really good question. So they work basically by reducing your appetite. Now, I like to be really clear. I know it's January. I know that it's all about weight loss, but I don't actually like to make it about weight loss. I think that's kind of a negative term in some ways.
Okay.
I think that it's really good actually if we rephrase it and make it about healthy eating habits. Perfect. Because that's more long-term successful, and psychologically we're going to approach it a little bit different. But these basically work by reducing your appetite. There's no shortcut to losing weight or being healthy. You have to eat the right foods and have physical activity and stuff like that. But essentially, they reduce your appetite so that, yes, you eventually lose weight.
So who would be a good candidate for these drugs?
Yeah, so really anyone who's wanting to feel better, and make positive, improvements to health. You have to put the work in, like Hilary mentioned. So anyone that's really wanting to make positive lifestyle change, habit formation, if that's a goal for long, lasting success, that would qualify most patients. Although, of course, there are safety parameters. Safety comes first always. So we do have parameters in place in order to qualify certain patients. We offer a free consultation to anyone who is interested in order to chat more. We don't want to help anyone obviously become less healthy or underweight. So this is not for those who are wanting a quick 5 pounds of weight loss, but anyone who's really wanting that long-lasting health benefit.
All right, there you go. So why is Modern SLC Injections and Aesthetics the best place in town to go for these types of treatments?
So I genuinely think, as the practice owner and a nurse practitioner myself, everything that I create in my practice, I always think about how I can benefit clients. That's really important to me for long-term success. Integrity's the platform of which I've built my business. So everything that we do, we want to make sure it's personalized. There's a lot of places that you can go to and they'll say, okay, we'll start this and you do this and then this and then this and then this. And that might work for Sally or for Joe, but it's not going to work for Kenzie or Brittany. You know what I mean?
Yes, exactly.
This needs to be personalized. So everything that we do at Modern SLC is a personalized approach. So we really take that, we take into considerations. We meet with you every single week for the first month to make sure this medication is working for you. Make sure we're coaching you and, again, getting those different habits in place so that you can have long-term success. That's the most important thing for us.
Absolutely. And talking to you guys, I can already tell how much you care about the work you do and the patients that come in. Thank you both so much for being with us today.
Thanks for having us.